Hi everyone. In this presentation, I'm going to cover some of the basics related to conducting voice therapy. It's important to note that everyone's voice symptoms, voice use, and vocal hygiene habits are different. So there is no single approach that will work best for all clients with a type of voice disorder. So for example, even though two people may share a similar diagnosis of vocal nodules, one person may need to focus on specific vocal exercises, whereas another person may need to work more on developing healthy vocal habits. But for all clients, voice therapy has three components. These are behavioral therapy, or changing the way voice is produced, cognitive training, or changing the way the client thinks, and counseling, which is helping the client to become more aware of or deal with emotional issues. It's also hard to say what a quote-unquote typical voice therapy session might entail, as settings and patients may differ, but you should try to do the following for each client. First, engage the client in general conversation. Note how the client's voice sounds when they are relaxed and therapy doesn't seem like it has officially begun. Then segue into how the client's voice was and how practice of techniques from the last session went. You will want to note any questions or concerns the client has. Address them immediately and/or come back to them throughout the session. Third, pick one or two techniques to work on during the session. Don't overwhelm your client with too many techniques, but focus on mastery of a few at a time. Be sure that the client knows his or her goals and can articulate why the techniques they are practicing in therapy will help them achieve these goals. Finally, I like to end a bit early to assign homework between the current session and the next one. You'll also want to make sure that the client's questions and concerns have all been answered. Your authors really give a lot of discussion to the therapeutic techniques that are available to treat someone with a voice disorder. So you'll want to review the DVD that accompanies your textbook and maybe even go online and find some additional resources. But here we will cover some of the fundamentals. These are some techniques that seem to be widely used regardless of the type of client that you have. So these are relaxation, respiration training, elimination of abuses, the yawn-sigh technique, and vocal function exercises. But again, there are lots more techniques. So the first technique we'll talk about is relaxation, and everyone has some degree of stress in their lives. Some of this stress may manifest itself in the larynx. So check clients for bodily tension. If they seem to have stiff posture or rigidity, it's likely that they have a tense larynx too. Certain voice symptoms and conditions may be relieved with relaxation exercises, such as elevated pitch, shortness of breath, functional dysphonia, and more. SLPs can help their clients to relax by employing progressive relaxation techniques, among other strategies. I've given you an example of progressive relaxation on YouTube, and basically you work your way up the body, relaxing every body part from the toes up to the head. You as the SLP can walk clients through this, or you can play a video clip for them. You should try this though so that you can see what a difference it makes. So I recommend clicking on that YouTube link and following along with the person on the clip who is leading you through this progressive relaxation exercise. So as clinicians, we also need to ensure that our clients are using respiration appropriately. We should be demonstrating good posture and diaphragmatic breathing for our clients. The key here is to have the client use good breath support while maintaining a relaxed but not slouched posture. One technique is to have the client sit in front of a mirror to observe their posture and breathing, or you can have the client put a hand on their abdomen so they know where to breathe from. The client can also watch you to see how you use good diaphragmatic breathing. And the key is to help the client learn not to speak too much on a single breath of air. So clients should be cued to take replenishing breaths as needed, as they work toward having a good vocal quality that is free from strain. Gradually ask them to speak longer utterances, but only to the point they can do so without strain. As with all voice therapy techniques, it is most helpful if the client can learn to compare and contrast their old way of speaking with the new preferred way of speaking. In the case of respiration, the client should learn to recognize the physiological and perceptual differences between vocalizing with good and poor respiration. And note that I have given you a video clip that you can watch that may help you identify some of the postural aspects of good diaphragmatic breathing. We all know that poor vocal hygiene can cause many voice symptoms and disorders. I've provided some handouts with information for children and adults to give you some ideas about how to help clients recognize and reduce their vocally abusive behaviors. Remember that the quality of our voice and the way we use our voice is often tied to our identities and, in many cases, our incomes. So make sure that you help your client to develop and implement realistic changes to their lifestyle, which will not detract from their sense of self or their ability to perform their job. Your authors do a good job of demonstrating the yawn-sigh technique in the DVD, and I have found a YouTube clip of student clinicians practicing this technique. It's not perfect, but I think it gives you a good idea about how to explain this to your clients and to implement it. The purpose of the yawn-sigh is to relax the vocal mechanism. The key is to produce good breathing techniques and combine this with easy phonation. The yawn helps to relax the vocal mechanism, and the sigh and eventual phonation, if done correctly, should also be very relaxed. This is much like the concept of easy onset for clients who stutter. Start with a sigh, then an H sound, and then move on to words that start with H. You'll want to reassure your clients that the yawn is just for practice and will eventually be phased out of therapy. Clients should focus on how relaxed their voice mechanism is after the yawn, but they will not produce speech with an accompanying yawn in their daily lives. And we should remember that the vocal folds are muscles, and that like any muscle in the body, they may atrophy or become less flexible without regular use. Clients with vocal scarring, those with reduced range, and those whose voice are dysfunctional may benefit from a regimen of voice exercises. Joseph Stempel developed a set of relatively simple exercises that you can guide your clients through, and they can practice these several times a day. I will let you read the steps involved as presented in the PowerPoint slides, but I think it will also be very helpful if you watch the accompanying YouTube video for variation on these exercises. As far as I know, your textbook authors do not present vocal function exercises, so this is something that you may feel the need to go out and identify more online resources to really feel comfortable with these exercises. And it's very important that we be able to document our clients' progress. You can get samples of pre- and post-therapy voice, including audio tape and video stroboscopy recordings, as well as documenting acoustic procedures from the VisiPitch or electroglottograph. You can also develop graphs or use rating scales or quizzes to make sure that your client is making progress. And then how will we know when our clients have made enough progress to be dismissed from our caseload? One way is to ask clients for their self-report about the way their voice feels. So if a client tells you that his voice no longer hurts, that he's well understood, and that his voice sounds energized, this is a very good sign of progress and that it may be time to dismiss the client. And I've given you some other examples of dismissal criteria that may be reported from your clients. There are also more objective measures of progress versus client self-report, and if the client greatly reduces their throat clearing, hard glottal attacks, uses appropriate breath support, all of these things, then it may be likely that the client is ready to be dismissed. In other words, if they've met their goals. But of course, if the client undergoes laryngoscopy and the vocal folds look healthy, and they're using good vocal hygiene, these are also a good indication that the client's goals have been met, at least their voice goals. And in summary, I'm aware that students want to get a sense of exactly what they should do in therapy with a client who has a disorder. Unfortunately, it's a bit difficult when it comes to voice therapy because clients will have different needs and may respond better to some techniques than to others. You should be very familiar with the techniques we've discussed in this presentation. Watch the YouTube videos and practice these therapy exercises yourself. Also watch the textbook DVD, examples of these therapeutic techniques, and thoroughly read the chapter so that you're familiar with the techniques that we have not discussed, because they're important too. Understand that there is rarely a single technique that should be used to address a client's symptoms. For example, let's say you have a client who has a small mouth opening and speaks with a clenched jaw. You will know from your reading that the chewing technique is supposed to help with this problem, but your client has TMJ disorder, let's say, and the chewing technique is painful. In this case, there are any number of other techniques you could use instead to achieve the same effect, such as the open mouth approach or the yawn sigh. So focus on the client's symptoms and their physiological correlates, and then experiment until you find the technique that seems best suited for that client. Remember, even though your authors described 25 different techniques, there are many, many more. So focus on having a really good understanding of how to help your clients use good breathing, a relaxed approach, and good vocal hygiene. The rest are techniques that you can put into practice as you need.